Let me start off with the one that I sent you. Secondly, was you said that this could be used for, I think, up to 80 different applications, 80 different medical diagnoses.
Correct.
What are some of the ones that are not on the list of what they've been used with, but could possibly, like ADHD? I know you said cerebral palsy. Does this help with multiple sclerosis? So where are we at with like stem cells overall, and not just in the autism field?
Okay. Well, many people ask me what, can umbilical cord blood and its resultant stem cells do? And as we're finding out, it has the ability to turn off inflammation and turn on healing. And certainly autism is a neuroinflammatory disorder, and so it seems to work there. But there are other neuroinflammatory disorders, and especially most of the major neurodegenerative disorders are inflammation-based. So it's been tried in cerebral palsy, and it's been shown to help tremendously. The first Duke study that came out before the study on autism came out showed that 88% of the kids benefited with movements and all sorts of other stuff when treating cerebral palsy. The second thing is even the adult neurodegenerative disorders, multiple sclerosis, Parkinson's disease, Lou Gehrig's disease, ALS, even Alzheimer's disease, are all neuroinflammation. They have inflammation at their base. So they're starting to test these. Certainly, Parkinson's disease has been shown to be beneficial. Multiple sclerosis has been shown to be beneficial. Alzheimer's, it still lags behind a little bit. And that's because there are drugs that are made to treat Alzheimer's. And the FDA was a little bit wary about everybody jumping to this. And so the studies that were done on people within 30 days of death. Well, people who are in 30 days of death, it's very hard to help them because they've lost too much of their brain power. And as you know, this isn't magic. What it does is it turns off the inflammation and then allows the brain to heal itself. Well, if 99% of the brain is gone, then the brain's not going to be able to heal itself. We're starting to see applications in arthritis. It's been shown to grow new knee cartilage. It's been shown to grow, hip cartilage. And so, there's all sorts of kind of anti-aging protocols because as we age, inflammatory processes start to show up. One great application is juvenile diabetes. Most people don't know that these young children born with diabetes have an inflammatory problem and that they're attacking their pancreas, and they essentially kill the islet cells that produce insulin. And so there are now studies that show that some children are getting up to 1 year of the diabetes going away and not needing any type of insulin. Because juvenile diabetes is very difficult to treat, obviously. Kids aren't in charge, they eat too much, they eat other places, and it can lead to death very easily. But these are all some of the new stuff that we're finding things for umbilical cord blood and Wharton's jelly.
Very cool. And then is there a set number of treatments that a child or adult would need to have? And I don't want to say for it to be completed, because I don't think we ever complete it. But just to see, considerable change.
People often ask, how many times will my son or daughter need to be treated? And the answer to that is nobody knows. There's never been a multi-dose study for autism. All the studies are a single dose and see what happens. And we know that there's a quantum leap forward. It moves up. The question, and it plateaus, it never goes back down. The question is, what does the second dose entail, and what can potentially happen? Now, my biggest example is my son. I've treated him 6 times in 5 years. And we tend to see things better and better. There's a great paper called Neurogenesis in the Adult out of Keck Medical School, where they looked at the things you can do to actually grow brain cells after you become an adult. And, with the brain, you're almost born as an adult. There's not too much growth after, you get to your early childhood years. But fasting can increase neurogenesis. Significant exercise can increase neurogenesis. And umbilical cord blood and stem cells can increase neurogenesis. Those are the only three things. My son has a cognitive issue, and with the socialization and speech and repetitive behaviors, kind of the autistic things, I would say he got tremendously better after 2 to 3 treatments. But the cognition, being able to follow commands and increase his vocabulary, is still increasing. Just of note that my sister-in-law called yesterday to say that she went to lunch with him and said he used the word apparently in a conversation, and that he told a joke, and so these are all starting to be functions of upper level cognition. And so I'm pushing it. I'm trying to get him to read, understand money more. But I think that as of now, I'm working on cognition and not necessarily autistic symptoms. And the vast majority of kids with autism don't have cognitive issues like my son.
So let me ask you this. What was the biggest leap forward between treatment 1 and treatment 2 for folks who maybe they've come to see you, but they're still trying to, they've seen tremendous change in their children, but like, what did you see was the biggest leap forward between the first treatment and then maybe the second and third? I know you said some cognitive and
right.
Other things.
The biggest change over the first, 2 to 3 or 1 to 3 is conversation and socialization. He began hanging around with his peers, with his brothers, but more importantly, the cell phone became not something to watch a video on. It became something to communicate with others. He began to call his cousins. He began to call other relatives. In fact, my niece called me and asked, what's up with Marston? He just called me on the phone. And I said, oh yeah, he's starting to get better and better. So I would say that's the core symptoms of autism got much better. I think he slept better after the first dose, that he just seemed more calm. And so I think it's an amazing, therapy.
All right. And then what's the biggest difference between going to Panama versus coming to see you here in the States?
People often ask me what's the difference between Panama and me, or Mexico and me. And first of all, no issues with Panama. When the Duke paper came out and I realized that my child was too old to be treated at Duke, the first people I contacted were the people in Panama. And I spoke to them directly. I think they're real life researchers. They've been doing this. Neil Reardon is excellent, very well trained, and I think passionate about helping people with this type of therapy. But I do think there's 2 big differences. The first is they tend to use expanded cells, or they do use expanded cells, and they really drive that cell count up, and they give it over a course of days. In the United States, we have to use this as something called MMT, minimally manipulated tissue. So we can't stimulate the cells to grow to drive up the content. So we give you more cells. However, we believe these cells divide in the body. And there's never been a study that shows that expanded cells are better than non-expanded cells. If you think about it, each cell has a definite lifespan. Each cell has a certain capacity to regenerate. And whether it regenerates in the body or outside the body, that same number is there. Also, the more you expand it, the less they're able to do. And the FDA is worried about mutations and things like that. The second thing I think that's different, from me, as far as I know, is that they tend to use MSCs only, mesenchymal stem cells. And I think there's no doubt that the mesenchymal stem cell does the heavy lifting with autism. However, I think there's other data that shows the HSC, the hematopoietic stem cell, works hand in hand it makes you have a better result. There was a study out of China where they took autistic kids and they gave essentially a third placebo, a third MSCs alone, and then a third mixed back with umbilical cord blood. And if people don't know, umbilical cord blood is like chicken soup for healing. It has 5 different stem cells in it. It has got all these other anti-inflammatory factors. But one of the 5, or actually 2 of the 5 stem cells, one is the MSC, but it's only in about 3% of the total volume. So it's not really found in great quantities in umbilical cord blood. But the HSC is the hematopoietic stem cell. That's the primary stem cell found in umbilical cord blood. And that seems to play an immense role in taking out inflammation, especially in autistic kids. And so I mixed the two, just like this Chinese study did. And what they found out was if you mix MSCs with umbilical cord blood, they did significantly better than kids that got just MSCs alone. And both of them did significantly better than the placebo. So there's some early studies out now showing that if you mix the two, you drive up the MSC content by giving umbilical cord tissue, so-called Wharton's jelly. And Wharton's jelly is 100% MSCs. And you mix it with umbilical cord blood that has all these healing factors plus the HSC, you get even a better response. So that's what I do.
Okay, that actually explains a lot. So there's other countries that are in the same process, like experimenting with stem cells and seeing what the benefits are, right?
Correct. There are other countries that do this, from the Bahamas to South America to Mexico to China, Russia. Turkey's big on using your own bone marrow, and there's some studies on that as well. But I think a doctor friend of mine said, if you can ever figure out a way to make the body heal itself, it'll be better than any surgery or medicine can do. And I truly believe it.
Same. We get a lot of questions this is literally one of the most common questions, and it always deals back with insurance. I know we kind of touched on it the last time we talked, but what really has to happen for insurance to cover a treatment?
I think that it really has to be FDA approved for autism. I think that will be the single thing that drives it over the finish line. And there are several pharmaceutical companies and several universities that have filed something called an IND, which is an investigational new drug. And the FDA has already classified umbilical cord blood and umbilical cord tissue as a drug. And so I think that's actually the first step, is that it's not a transplant anymore, it's a drug. And that's because it can be used for, many different things. Not only the pediatric, malignancies, but something called inheritable metabolic diseases and things like that. So that's the first step. And then there needs to be a lot of experimentation done, phase 1, phase 2, and phase 3 studies. And as soon as that gets worked out, I think it'll happen. The downside is that, the average length of time from discovery to FDA approval is about 17 years. I think this can be fast-tracked because it's such a big problem. And I think it can also be fast-tracked because there's no other treatment, that's been shown to be effective. There's not many, supplements or other things that the FDA can say, that this is equivalent to or better. There's nothing there to compare it to, which is a phase 4 study. That's usually the study the FDA wants. Is this better than anything other on the market? Is this better than anything currently on the market? And there's nothing currently on the market like this. So I think it will be covered by insurance. I just don't know when.
Would you provide any of your records if the FDA asked for that? Would you be one of those people to be like, no, really, this doesn't, and here's my evidence, kind of thing?
Right. And I, without a doubt, obviously, just by the way I set up, I would call each individual patient and say, but usually when the FDA wants it, depending on what they want. They don't necessarily want names. They just want, 4-year-old child went from here to there and stuff like that.
Just want the data.
It's exactly the data.
So parents getting on the phone, calling the FDA, doing all the things that parents want to do to, help their child. This just has to run its course.
I think it has to run its course, but I think that the FDA will end up being pressured by two people. One are the pharmaceutical companies, because obviously, they're pushed to make money, and they're investing a lot of time and energy in this, and they're seeing, it fulfilled, because I believe it'll be a treatment for stroke and heart attack, and other things. And the second is probably politically. I think it's starting to get to the point where people should contact their senators and their congressmen, especially when more favorable data comes out. And I think eventually there'll be congressmen and senators who have kids on the spectrum.
Yeah, because this is still kind of in its infancy, isn't it?
Correct. Well, you have to remember 2019 was the first major study, where they looked at it. Now placebo studies, but what happened at the end of 2019 was the pandemic, which set everything back a couple of years. So things get ramped up again, in 22. It's just 24. I believe Duke had 3 small studies that they just completed in February of this year. So that'll be interesting to see what they found out. I believe they gave MSCs alone, and they did something called passages, which is an interesting way to treat the cell. It's not really stimulating it, but it's allowing it to grow a little bit. So I think when that data, comes out, we'll be able to draw more conclusions.
Well, how long does that data usually take to come?
I don't know. I actually emailed them and, didn't get the response,
Gotcha.
I actually asked for the data before they published it. And of course, that's probably a hard no, but
I know that's sad, right? People like, hey, we're friends.
Yeah.
All right. What is the importance of having adult stem cells versus embryonic stem cells when we're dealing not just with autism, but just in general treatment?
Yeah, well, there are 2 big broad categories of stem cells: embryonic stem cells, or so-called fetal stem cells, and adult stem cells. And I think, to put it mildly, embryonic stem cells were made to make a baby, and adult stem cells were made to heal, were made to fix things that go wrong in our body. And if you think of it like that, adult stem cells, the way we're used now, have never been shown to cause tumors and things like that, whereas embryonic stem cells have been shown to cause tumors and cancers and that sort of thing. So, and most people don't realize, as soon as the fetus gets kind of midway through the second trimester, it actually becomes an adult, because it's completely formed. All it has to do is grow. And so we have all these adult stem cells that are circulating in our body that can help repair the gut, the heart, the liver, the brain, and take care of the kind of the assaults on our body, outside the womb. So I think it's very important to get adult stem cells versus embryonic. But a lot of people think that the cells that come out of an umbilical cord are fetal or embryonic stem cells, when in fact they're adult stem cells.
Yeah, because I think that we've gotten a lot of people asking, is this ethical? Because you're using embryonic, and we have to explain, no, it's not embryonic. They're live stem cells. And so,
right, all these adult stem cells are derived from live, healthy births. These are, what we call products of conception that would be thrown away if the so-called afterbirth. And unfortunately, probably 99% of the time, it still gets thrown away. We need to really start focusing on collection systems and making, it just kind of be routine of care. If you're not saving it for yourself, it'll go into a pool, because they will expand the indications for this stuff. And right now, you never even hear of a bone marrow transplant, because they figured out how to recreate a complete, immune system through umbilical cord blood. And only 1 in 7 people who need a bone marrow transplant for leukemia actually has a potential donor in the family. So 6 out of 7 of these kids with pediatric leukemia and lymphoma need umbilical cord blood. And so how they get it is that if you donate it, they actually, work it all up and they put it on a public bank that says, we have this umbilical cord blood. It has this characteristics. And if there's a match, then it goes to that child.
All right, last question. For those who can't do stem cells, are there any recommendations for supplements to help with inflammation?
There's not a lot of data on supplements and inflammation, unfortunately. However, we know that, kind of a high sugar diet and a high processed food diet increases generally the inflammatory load on the body. We know that obesity increases the inflammatory load on the body. We know that exercise and running around and playing decreases the inflammatory load on the body. I think that as therapies go, hyperbaric oxygen, might be, very beneficial. Hyperbaric oxygen, just a single time in the chamber, has been shown to increase the amount of circulating stem cells by 100%, and after a few treatments by about 800%. So if you get all these stem cells starting to circulate through the body, hopefully some of them end up in the brain and start to treat that. But I would try to decrease the inflammatory load, increase a healthy lifestyle. And there are things, mitochondria, supplementation, glutathione and things like that help the body deal with inflammation. So I would lean toward those supplements.
And that's why, like before treatment, you got your office recommends, anti-inflammatory diet, looking and making sure that kind of stuff is there, because you don't want to, like I think you said in the last time, we don't want to inject the stem cells and then it goes to your gut first, as opposed to going to the brain and spinal cord.
Yeah, but even if there's a huge gut-brain axis, there are studies out there with kids with autism that if they just give antibiotics to kill everything in the gut and then replenish them with new gut bacteria, their symptoms get remarkably better. So I've had children that have had tremendous gut issues, not potty trained, 10 years old, chronic diarrhea or constipation, get stem cells, and they're still nonverbal, but their gut's completely healed and they're potty trained. Mm-hmm. So it's interesting how the body triages the stem cells. So most children with autism have what we call peripheral inflammation as well, which I think is another reason why to get umbilical cord blood, because that HSC, the hematopoietic stem cell, has the ability to really control peripheral inflammation of the gut, the liver, all our other organs. And that eventually ends up helping the brain as well. And so, yeah, anything you can do, healthy lifestyle, healthy eating, anti-inflammatory supplements, hyperbaric oxygen, all that helps.
Inflammation's the real trigger here.
Right. I think that, my wife said, there was the greatest generation before us that fought World War II. We'll be known as the inflammation generation because of just, lifestyle and other, hits in the environment,
Yeah. Anything else new in treatments or in the stem cell world that we need to be aware of that we can help talk about? Or
not that I know of right now. I'm interested to see what this new Duke study is. I think there's some papers that came out in 2023 that just were summaries and kind of explained where the research is going. And it seems more and more people are now starting to really think that this could be a breakthrough. So that's good. The more people that are doing it, the more data the FDA has, and that people have their own little individual thoughts, and that takes their research in a little different direction, but it adds to a greater body of knowledge.